Good afternoon, everyone. Thanks for being here today. Hoping you're enjoying your summer. It went very quickly, and we're really looking forward to bringing all of the kids back into school. We wanted to start this parent forum now, and we'll be holding another one next week and the week after. Things are changing with the state, and we'd like to keep you abreast as we learn more from the state. What we have for you today is a presentation for today. And if changes are made to that over the course of this week, we'll update you in next week's. We will be recording this, so you'll have it. I know many of you are possibly working at this hour, so we're going to record it. That way you could take your time, and we'll also make the slides accessible to everyone. On the call with me today, I have Assistant Superintendent Mike Foran, Jackie Maddie, who is our nursing supervisor in everything COVID for the last year and a half. We have Mary Ellen Manning, our Director of Personnel and Talent, and we have our Director of Pupil Services, Mr. Mark Spalding. So we're here to answer your questions. We do have slides prepared. Feel free to ask a question. We'll have someone monitoring that. We'll stop if we get a lot of questions and try to answer them in real time for you. So without further ado, and I want to say thank you to Matt Canada, who's always behind the scenes helping us out here. So let's start rolling. Has to be said, vaccination is currently the #1 prevention strategy for all people 12 years of age and older. We encourage anyone to get the vaccination, to do so as soon as possible so we can get back to 2019 normal. Thanks, Matt. So one of the first things, I do want to say that for the last 3 or 4 weeks, all of last year, we met weekly Tuesday morning with the State Department of Education, the commissioner, and Dr. Matt Carter and his staff with the State Department of Health, Public Health. And so those have been really informative. They helped us a lot throughout the year. You know, any kind of closures, anything like that, we've never made in isolation. We always work with our local health department as well as the State Department of State Public Health Department. Beginning the week of September 20th, the State Department of Public Health will be providing on-site COVID screening for all unvaccinated students and staff. This is for pre-K through grade 12 in terms of screening. It is voluntary. Parents will have to sign a consent form. If you would like your son, daughter, or your children to receive weekly screening or testing, Jackie, you can speak a little bit more to it. I guess it's less invasive than it's been in the past. Did you want to pick that up there?
Yes, the screening now is with a shorter Q-tip or cotton swab in the lower end of the nose. So it's no longer way far up. It is a very quick swab. It will go to the lab. If your child or your children test positive, you will be contacted by the lab, and they will let you know. They'll also be contacting me. I'm the contact for the school district to tell me that the person who has tested positive so that I can start the contact tracing.
So, and again, I want to stress that it's voluntary. Parents have to sign a consent form to have their students receive this weekly screening. It'll be right on site in the children's school. So we'll be having someone going from school to school. And this is for our staff as well, any unvaccinated staff. Thanks, Matt. Next slide. I know that this has been a concern, not just in New Britain, but across Connecticut. The State Department of Education has mandated that there will be no universal remote learning for the 21-22 school year until further notice. We added that because, again, things can change over time, but we are opening with 100% students in 100% of the time. The rationale last year was clearly the pandemic, and we do understand that the numbers are rising here in the state and in New Britain. But that was made possible last year by the state government's expanded authority during public health and civil preparedness emergencies. This year, from the state, they have a shared commitment to equity, and it requires our refocusing on in-person learning opportunities. And it's a balance between physical health and mental health, social, emotional health. They feel strongly that the opportunity to be in the classroom, peer and adult support, access to nutrition and health resources, as well as just interacting with one another. Through their research over the course of this past year, you'll notice in some further slides, being in the classroom and being 3 feet apart, masked, is considered okay. Meaning that they have done their research. Dr. Carter explained it in one of our Tuesday morning meetings, that the rate of passing the COVID virus in this situation was minimal. Jackie, did you want to expand on that?
Sure. The Center for Disease Control specifically did some research about students in the classroom. So we're talking about students sitting at their desk or sitting at their table, facing the teacher. They measured the transmission of the virus, and they found that a 3-foot distance, that the virus was not traveling 3 feet. It was traveling, I believe, if I remember correctly, it was about 1.5 feet. So they feel that a 3-foot distance is perfectly fine in the classroom setting for students, keeping them safe.
Thanks, Jackie.
Jackie, we have a question too, I think, very quickly, going back to the testing. How long do the results take when those tests start September 20th if the parents sign up?
They are said within 24 to 48 hours. We'll get the results. You will not hear anything if the student tests negative. You would only hear if the student tested positive.
Thanks, Jackie. And then the next is, are we going to be maintaining the 6-foot distance? And so in the classrooms, no. But again, we're going to see this in further slides. There are modifications from last year to this year. Last year, when the state was meeting with us, they gave us very strict guidelines last year based on 1 year ago what they knew about the COVID virus. Now that they've had a year to learn it, study it, they've given us a new set, a modified set. You'll see a lot of similarities, but there are some loosening or less restrictive protocols in place.
I see there is a question here that asks if students can be tested if they have symptoms. So what the state is providing for us is a weekly scheduled screening. Anybody who has symptoms will need to, or recommended to, get tested. I am working right now with the school-based health center provider to see if they can offer testing on site for those who are feeling ill at one of our school-based health centers. At this time, though, there is no regular testing for people who are ill or who have symptoms on site. You need to go to your provider to a walk-in, and we hope very soon there will be another open community testing site in New Britain, and we would refer people there.
Thank you. All right, I'm gonna, next slide, Matt, and I'm gonna just try to answer. Ms. Bermudez, I understand with Delta affecting children, the state, again, and I will say to you, we have to go full in. It's 100% full in and full time. There will no longer be half days on Wednesday. We're going back to our schedule that we had pre-COVID for the students. So, Ms. Walker, online is not an option. Remote learning is not an option. We'll share the slide deck with you after. So I wanted to delineate, there are three, we have a slide on remote as well. I wanted to, we are 100% in. We do not have remote learning as of now. Will it change? If it changes, it will be from the governor's orders or from the State Department of Education or Department of Public Health. That's not a decision we can make. All cities and towns in Connecticut do not have remote learning. So options, and we do have some families that are calling us on this. Mark, did you want to take over this slide, please?
Sure. Good afternoon, everyone. Yeah, there have been some questions coming our way regarding homeschooling and homebound instruction. And so at this time, I'd like to talk a little bit about what that is. So families are required to send students to school per the law, kindergarten through 12. Now, the Connecticut does allow you to do homeschooling. The families do have that option. It is the equivalent of taking a child out of school, moving to another town, or going to a private school. The district at that time would not have any supervision over the instruction that's occurring at home. Families, parents would have full responsibility for educating their children at home. And in order to implement this, parents must notify the superintendent's office that they'd like their child homeschooled, and we will acknowledge that. It can be sent to a designee as well. Parents just need to understand that when a child is being homeschooled, again, the district has no obligation to provide educational related services at that time, including special education services. If a child has an IEP, technically the IEP no longer exists at that time. The same is true for a 504 plan. Now, if the parents choose to re-enroll the child back into school, services would begin immediately. If the triennial reevaluation period is passed, that normally occurs every 3 years. If that is passed during the time when the child was at home, we're still going to re-implement the IEP that was in place when the child was in school, and then we'll go to evaluations. So the child would have an IEP when they came back. Okay. You also have under the law as well. Connecticut allows someone at the beginning of the year, if you have a child who is 5 years old, you can come to school and you can in person and sign a form saying that you're exercising your right not to send the child to school for kindergarten. The next year, for a 6-year-old, you can also do the same thing. But in those two instances, up until age 7, in those two instances, you'd have to come in person and fill out some forms. Okay. The next slide, please. Jackie, do you want to talk about Homebound?
Sure. For students who are ill, who are too ill to come to school or too compromised to come to school, again, following the State Department of Education guidelines, the school district is required to offer homebound or hospitalized learning. This is not what some people thought as remote learning. This is something that's offered because the child physically cannot come in. Usually it's because they're hospitalized, recovery from an illness, an accident or surgery, or they have a chronic medical condition or mental health condition. Perhaps it's a relapse. There is a form that the treating physician requires. So if the child, for example, has a mental health condition, the mental health treating physician would complete this medical statement. The statement has to include a specific diagnosis, include supporting documents, and the physician has to give us an estimate of when the child might be able to return to school. The instruction, the hours of instruction that are provided are based on the student's grade level. For students in grades K to 5, it's up to 5 hours a week. For students in grades 7 through 12, 10 hours per week. And the instruction is depending on the child's ability to have someone work with them, may be provided in the home, in a hospital, in a community setting such as a public library or some other agreed upon location. Again, there is a specialized form that the physician needs to fill out. That form gets sent back and then is reviewed, and we move forward from there.
Next slide.
Okay, so our next slide talks about face masks. We are requiring face masks to be worn by all staff, students, and visitors while in the school. That is part of the governor's current directive that runs through September 30th. The face masks need to completely cover the nose and the mouth, and they need to be worn when they're inside school. We do provide PPE as required. Students are also required to wear masks to and from school when they're riding on a school bus. This is part of the CDC federal order requiring face coverings on public transportation. Our principals will make sure that they establish times, just as they did last year, for mask breaks during the school day. Students who are taking a mask break can be socially distanced, and many times they are outside so they can get some fresh air.
We have a question.
We have a few questions. Yeah, go ahead, Mark, start.
So we have one from Ms. Bermudez. Exactly my point. My child is severely autistic, never keeps her mask on or understands what's going on, and I have a compromised immune system. So we can discuss that. So when we're talking about the medical documentation that is required for homebound instruction, it relates only to the child or the student who attends school, not family members. In fact, there is a case that's now pending with the state, I believe, but I know that the Department of Ed has actually denied a couple of these already. And so I believe that's being challenged right now, but it is only relating to individuals that are attending school that may have a compromised immune system. Jackie, do you want to talk about the masks?
The exceptions are actually on the next slide.
Okay.
So, but Jackie, before you move on, we have two questions. One, this goes to Ms. Walker. We will be having mask breaks for students, and if I'm understanding your question correctly, if your child feels uncomfortable taking their mask off while it's a break time, they don't have to. You know, and typically we do the mask breaks outside, and we do have the tents put up on every site as well, so in case of rain or whatever, students can go out there. And then, Jackie, there's one from Ms. Jejic, and describe what you do for contact tracing when a student's found positive.
We're going to talk about that in a little bit.
Okay, sounds good.
Okay, we do have exceptions for face coverings. Anyone who has a medical reason that makes it unsafe to wear a face covering, they do need to present a signed letter from a licensed medical provider as to why the student cannot wear a mask or a face covering. Generally, the student is incapacitated or they're otherwise unable to remove the mask without assistance. And to address the question that came up, there are exceptions for certain special education students and other special populations. This is usually included as part of their IEP or perhaps their Section 504 plans. Face masks and coverings can be removed while students are eating or drinking, when they're outside of the school building, in phys ed class, when they're outside or otherwise taking mask breaks, and at recess.
Okay, before we go further, I'm going to speak a little bit to lunchtime now. It's going to be building specific, right? We've talked, because every building is different in terms of spaces. At the elementary level, there will be, and at the middle schools, there will be similar situations as they had last year. Some students eating in their classroom, some students eating in the cafeteria. At the high school, the majority will be in the cafeteria. There are some overflow spaces where students who need to sit from separate, they will have that available as well. That is lunchtime that students will, and again, for the littles, the kindergarten through grade 5, they have a 30-minute lunch typically, but that also includes some recess time. Not all children take the 30 minutes. And so it'll be about getting the students to eat their lunch in an adequate amount of time and then getting them on to recess outside. I think I covered those. Okay. Jackie, can we go to the next slide, please? As far as transportation goes, it's available to all of our students who live outside of the walk zone as usual. Special transportation will be provided for all of the students who have special transportation identified in their IEP. All passengers and drivers must wear face masks while they're on the bus. We will continue to monitor the governor's office and direction on mask wearing recommendations. But as it stands now, students should practice social distancing while they're on their bus whenever possible, similar to what we did last year. When your students or your children walk to the bus stops, they should have their masks ready. The bus drivers will make sure as they get onto the bus that they're on securely over the nose and the mouth. And the windows will be opened as we had last year. We cracked most of the windows just to keep airflow in there. Next slide. So before I even go on, Ms. Figueroa, if people have the vaccine, do they have to take the COVID test? No, they do not. The screeners that we're offering are really just for those students and staff who are not vaccinated.
And then I will answer the question about face shields. A face shield is not a substitute for a face mask.
But can be worn in conjunction with a face mask if they'd like.
Okay, I can go over the cleaning and disinfecting and hygiene. So good afternoon, everyone. We are going to continue to have daily disinfecting using 24-hour sanitizing wipes on all of our high touch, which are our high frequent surfaces. And that's going to include door handles, handrails, sink handles, restroom surfaces, and all of our recess equipment. It's recommended that all of our students bring their own water bottle from home instead of using the water fountains. And students will have opportunities, however, throughout the day to refill their water bottle, especially as we enter school during the warm August and September months. Hallways and classroom doors, as aligned to our fire codes, will be left open. This will allow for circulation as well as limit high-touch surfaces such as doorknobs. The last thing that I want to point out in regards to disinfecting is we have designated bathrooms and changing areas for our students that are in each and every building that are in need of diapering. And of course, we will continue to review our protocols for all of our staff, our facility staff, and all of our employees in regards to cleaning and disinfecting our schools. Okay. We're going to continue to adhere to all of the ventilation systems and requirements the state has asked us to adhere to. We're going to continue to utilize, especially as we start up school, our outdoor spaces and canopies that are at each one of our building sites that we used so frequently last year. Gloves are required of our staff to be used whenever there is contact with blood and or bodily fluids. And it's important to know that your principals will work and continue to work that and make sure that all of our educational materials will be cleaned as frequently as possible. It's important. I know students like to have their own personalized animals, especially our most youngest students, but belongings such as personal stuffed animals and other toys at this point are strongly discouraged. Each school will ensure that the staff, students, and certainly our visitors have access to soap, water, and hand sanitizer that will contain 60% alcohol at all times.
Thank you. And I just want to address two comments in the chat. Ms. Jejic, you're right. I see Ms. Blowicki had asked the question and has concerns over the masks. The executive governor's executive orders are in place until at least September 30th, that all students, staff, visitors, and volunteers who are in a school setting or in a school building must wear masks. That is his executive order at up until September 30th. So Jackie, you're going to take this. What happens?
I am, but I will also address the screening question. Parents sign up to have their students screened. It's you don't have to sign to opt out to not have your student screened. If you would like to have your child screened for COVID every week because they are not vaccinated, you would sign up. If you don't choose to participate, you don't have to do anything. And that's provided free of charge. All right, what happens if a student is a close contact? This is not any different than what we did last year. The school nurse and the school administrators will work to determine who the close contacts are. We do have a chart coming a little further in the slides that will show you the distance that we measure. And then what we will do is if the child is 12 or older, we will ask if the child is vaccinated. If the child is 12 or older and they are vaccinated, then there's nothing that they have to do unless they have symptoms. If the child is under 12 or the child is not vaccinated, then we would be notifying the parent or the legal guardian that the child is has been a close contact and the child will need to quarantine. If there's any questions, you certainly can contact your child's school nurse. They will go through with you. And we do have a chart that you can follow to see about the quarantine time.
Thanks, Jackie. Can you talk a little bit about the separate room that we have set up, that we had set up last year as well, just in case parents have questions on that? or
Yep.
students?
All of our schools have an isolation room. This is what the CDC and the DPH has called it. It is staffed right now by a nurse or a nursing assistant who will be there to supervise the children. Children go to the isolation room if we find out that they have been exposed to someone who has tested positive for COVID. If a family calls us and tells us that their child has tested and they just found out they were positive for COVID, or if the student has COVID-like symptoms. And we do follow the state of Connecticut Department of Public Health guidelines for COVID symptoms. In the isolation room, they'll be assessed by the nurse, and then the parent or guardian will be contacted to pick them up and bring them home.
Thank you, Jackie. And I just wanted to, there was a couple I want to speak to. The screening, it is optional. I know someone referred to they still have their children's vision checked every year. This is from the state. It's a service that they're providing for parents who might be uncomfortable sending their child to have a weekly test to know whether or not their child's tested positive. And Ms. Glowicki, I'm hearing you. I promise I'm hearing you. I understand it's not only the masks that some families are looking for remote options, but that is not an option for New Britain, for Berlin, for any of the cities. We don't have the authority to say that we will be having remote learning. That right now is in the state's hands, and that's something that if you want to notify me separately, I can give you contact information and you can express your concern there. I will say, while we are not, it's 100% full in, there are situations where we might have to close schools if there's a large outbreak. At that time, let's just say, for example, 2 classes, we have a lot of positives in 2 classes, we will shut those 2 classes down. If we have to shut down classrooms because of the infection rate, there will then be remote learning. But it can't be universal to say that we will always have a remote learning option. The Board of Ed doesn't have a right. I'm not sure when you say isolate a student, I'm not sure if you're referring to a student who's presenting with symptoms. We send them actually to like an annex to the nurse's office. I think that's probably what you're referring to. And we do that just so that if this child is potentially positive for COVID, that we're not infecting other children. Go ahead, Jackie.
Okay. The COVID screening during the school day, there may be times during the school day when we need to screen a child. They may be presenting with symptoms. They may be telling us, oh, my mom has COVID, or I was with my friend and they have COVID. If they are identified as a close contact with someone at home or at school who's tested positive for COVID, they will be removed from class and taken to the isolation room. This way, if by chance they are infectious, we're making sure that we're not spreading the virus around. For students who are age 12 or older, the school nurse will contact you or speak with the student or check the student's vaccination records if you've provided that to determine if the student has been vaccinated. If it turns out that the student's fully vaccinated, as long as they don't have any COVID-like symptoms or flu-like symptoms, they can return immediately back to class. If the student is not vaccinated, then they would remain in the isolation room with the nurse, and the parent or guardian would be contacted to pick up the student. And then for students who are ill and have COVID-like symptoms or flu-like symptoms, they would be removed from class and taken to the isolation room. Again, students do not stay alone. They are with an adult.
It's really another nurse's office where the typical traffic doesn't go into.
Right. And then they'd be assessed by the nurse. That means they'd have their temperature taken, We would be interviewing them and assessing them for their symptoms. We would contact the parent or legal guardian. We would follow the CDC guidelines for quarantine, letting you know how long your child needs to quarantine. And then we would be making a recommendation to you that you contact your student's medical provider to report the illness and the symptoms and get follow-up advice. We also provide parents with information about community resources. Should there be a COVID community testing site open, we would let you know where that is and hours.
Thanks, Jackie.
You're welcome.
Next slide, please.
Here's our quarantine. So we think that this should help you out. So we have two different situations for spacing. One is for students who are in the classroom setting, and the other is for students when they're outside of the classroom setting. So if you have a fully vaccinated student who is in a not classroom setting, let's say they're in the cafeteria or they're in the gymnasium, they've been exposed some other place, then this will tell you when they have to quarantine. So if you are fully vaccinated, you have to quarantine if you have COVID symptoms. If you are fully vaccinated and you are in the classroom setting, you have to quarantine if you have COVID symptoms. If the student is not vaccinated, then if they are in the not outside of the classroom setting, they have to quarantine for 10 days if they were closer than 6 feet to someone who has tested positive for COVID-19, even if everyone is wearing a mask. If they are not vaccinated and they are in the classroom setting, they would have to quarantine for 10 days if they were closer than 3 feet to a person who's tested positive for COVID-19, if everyone is wearing a mask. And if they are in the classroom setting, but the students in the classroom setting are not able to wear masks, then they would have to quarantine for 10 days if they were closer than 6 feet to the person who has tested positive. As we're contact tracing, we are always looking at the person who has tested positive and those people who have been within that proximity to the person who's tested positive.
Jackie, can you give the rationale around the 3 feet while in the classroom, as was discussed in our DPH call?
So the DPH and the CDC has said when students are in what we're talking about in the classroom, the students are seated, they're not walking around in the classroom. And so the respiratory droplets that are coming out traditionally and further the studies they've seen are not traveling much more than about 1 foot to 1.5 feet. So 3 feet is a good distance to quarantine those. Those outside of that really are not coming into contact with those droplets. When you're talking about outside of the classroom setting, then you're talking about people who are moving around, the droplets moving more forcefully because the people are moving, and then we're going to the 6 foot setting.
And also, Jackie, can you talk about the parent notification if a student is tested positive in the classroom? So specifically, will they let all parents know, and not just the ones close to an infected child in the class, that someone tested positive in that class? Like
So there's
send out for lice.
Right. So there's 2 notifications. If your child is a close contact, so within that 3 feet in the classroom or within that 6 feet in a non-classroom setting, you will be notified that your child is a close contact to someone who's tested positive. You'll be told that your child needs to quarantine, and we will recommend that you have your child screened for COVID 3 to 5 days after their exposure. If there is someone in your child's school who has tested positive for COVID, you will be notified that there was someone in the school who tested positive for COVID. This is something that we did all last year, and we will continue to do that.
Jackie, also, so go ahead, Mary Ellen.
Jackie, can you address one of the questions is why only unvaccinated students and not vaccinated?
We're following the CDC guidelines. So the CDC guidelines say if you have been fully vaccinated, which is you've received all doses of the COVID vaccine plus 2 weeks, you do not need to quarantine unless you have COVID-like symptoms.
Thank you. And to all folks that are asking about what are students doing if they have to quarantine, we are getting to that. So I don't want you to think we're ignoring or not answering you. We will get to that slide soon.
And then this is the quarantine list for students who have traveled. Again, those students who have traveled either domestically or internationally, if they are fully vaccinated, they do not need to quarantine. If students are not vaccinated, if they have left Connecticut, they have traveled domestically, or they have traveled internationally, they do need to quarantine. If they are tested on day 3 to 5 after they return back to Connecticut, as long as that test is negative, they may return to school on day 8. If you choose not to be tested after returning to Connecticut, you need to quarantine and you may return to school on day 11, provided you have no symptoms.
Thank you. And this is now just talking about if your child plays sports or is a student athlete and quarantine for that.
So the CIAC, the Connecticut Interscholastic Athletic Conference, came out with a set of guidelines earlier this week. When student athletes participating in sports need to quarantine, whether we're talking about practices or we're talking about games. For students and coaches who are fully vaccinated, they do not have to quarantine after close contact, provided they don't have any symptoms. However, they do recommend that if they have been exposed, even if they're vaccinated, that they get tested between day 3 and 5. If the student or the coach is unvaccinated and they have a close contact and they have no symptoms, they need to quarantine for 10 days. And then they need to produce, if they'd like to come back within at the end of that 10 days, they would need to be tested for COVID between day 7 and day 10 and produce proof of a negative result. If they choose not to be tested, then they would need, by CIAC regulations, they would need to quarantine for 14 days, and then they can return. This is return to play, return to sports, not return to schoolwork. So the school quarantine is 10 days. The CIAC is a little bit different based on whether or not you have tested.
Thank you. I want to answer Miss Bassett's question around her concerns on the amount of absentee or the amount of days if students have to quarantine without starting to get phone calls saying your student's out. That's a really good point, Miss Bassett. And so we'll be working with our IT department around denoting. So if it's an absence because of quarantine, it'll be noted as such. A quarantine is not something that you really have control over if it's in the school. So, and again, so it'll be noted that it's quarantine, and we'll know that that child needs to quarantine for X number of days. I hope that helped with that one. Okay, next slide, Matt. Thanks. So this is one of the questions people were asking. How will my child stay connected during quarantine? We are really here to partner with you. The fact that we don't have a remote option is a state mandate. That is something that we have to follow. So if your child has to quarantine because they're considered a close contact, first off, they will be marked absent, but it will be marked absent for quarantine. But we'll have opportunities to connect with their building level staff. The first thing, we will be maintaining Google Classrooms. That's grades 2 and up, and we use Seesaw for our youngest learners for K and 1. Teachers will continue to maintain those Google Classrooms and Seesaw this year that quarantining students will have access to see all of their assignments, have all very similar to last year while they were in remote. They're able to submit their work and send their questions directly to their teachers during the time that they're in quarantine. Students and families will also have access to all the teacher lesson plans for pre-K up to 12 that are posted every Friday afternoon for the following week. They'll still have access to instructional materials while they're in quarantine. If it's, especially at our younger grades, if it's a student who needs to take home a workbook that's in their desk, and if they weren't able to do it, we will make sure the building principals will work with you to make sure your students have what they need to continue. And then after school virtual academic support sessions are going to be made available for elementary students by grade level, and it's for elementary and secondary students. Sorry, that's a typo on my part. By grade level and by content area. So at the elementary levels, we'll have teachers that will be working in our, what we're calling our after school virtual academy. And so at that time, if your child, while working during the day on the lessons, because you have all the materials that you need to work, if they have questions or need support, the teachers will be there after hours to help out. Ms. Morel, what's the criteria for a full closure? I can't answer that easily. Whenever we have a closure, the local health department is sitting in with us. It's always around the infection rate, and that isn't a decision that I've ever made in isolation. It's always with the medical professionals next to me who make the recommendations of whether or not we stay open or we close certain sections of the district. There will be after school programs for middle school. We have quite an extensive after school programming this year. We just wrapped up a very, very busy summer session with thousands of kids in, and we will have similar for our after school programs as well. Next slide, Matt. That brought us to the end. I'm going to go back. If we could go back and start looking at some of the questions that maybe we didn't get around to answering, that would be great. Feel free to put more questions in now. That's really it for us for the slideshow. I'm going to go back to the top and start. And if you see a question, and just read it out.
Kathleen D asked the question about notifications. As a K-8 parent, she didn't feel like the notifications were good enough and wanted to know why we couldn't identify what room a child was sick or isolated in. Why can't we identify down to the building, school, and then child level?
Classroom level, you mean, right?
Classroom, yep.
That is something that we can ask, but I would assume that the closer we get to that student's classroom, we're starting to violate that child's rights in terms of being able to identify who the student or staff member is that is tested positive. Mark, you can help me out there. You've got the law degree, and I don't want to misspeak.
Well, right, there's confidentiality, obviously, with respect to students. And so, the fact of the matter is we have to have a place for those students to go to, but we have to be very careful on how we, that we don't identify staff or students. And also, Jack, you can speak to the medical piece with respect to the HIPAA. But we have to be very mindful about confidentiality.
Natalie Torres asked about, will there be sports available in middle school? We are planning to run sports in middle school. So yes, is the answer to that question. And there's a question about, I think the testing, going back to the beginning, Jackie, is it a PCR test or rapid?
It is a PCR test. That's why the 24 to 48 hours for the results.
And for those parents who maybe came in a little bit late, we started our presentation, and there was a lot of chatter going on in the chat box around, is it mandatory that our kids are screened every week? And it's not. It's a voluntary thing. You'll get a form asking whether or not you'd like your child to be tested on a weekly basis, anyone who's unvaccinated, to be tested on a weekly basis. It'll happen right in the school. Certainly you can opt out. We don't anticipate that everyone wants that, but it is an option that the state is using some of their American Rescue dollars on to provide us with contracted services to come into our buildings and help us out there. So I hope that cleared up any misunderstandings with that.
Ms. Santiago asked about cleaning supplies and PPE. I want everyone to know that we have sufficient, more than sufficient, cleaning supplies and personal protective equipment for all of the staff here.
Jackie, there's a question that comes up quite often, actually, that we're getting regarding asthma. Could you speak to that? What happens if kids have asthma? Could you talk about that a little bit, please?
Sure. I've actually been meeting with our school medical advisor and discussing that. The Center for Disease Control and the Department of Public Health is still recommending that we not give nebulizer treatments in school, and that's because the nebulizer treatment causes the particles to blow out all over. However, many of the studies that have been done have shown that using a asthma pump, along with a spacer, the face mask style spacer, works almost, if not as well, as a nebulizer treatment. I am working closely with pulmonology at Connecticut Children's Medical Center on those students who have very significant issues to make sure that they can get the treatment that they need. But we have been able to manage very successfully using the pump plus the face mask. If there were a dire medical emergency and a student needed to have a nebulizer treatment, we do have the ability to do that.
Thanks, Jackie. Two other questions. Hi, Darlene. Good to see you asking a question. Will disinfecting be done every 2 hours in the building like last year? So the disinfecting will be happening. We do have 24-hour wipes now. The 24-hour wipes will be used on all the high-touch surface areas, and they are now a part of all custodians' tools that they will be using. So they are 24-hour wipes. They don't need to be done as often. Hope that helped. And this is kind of off the topic, but I'm going to answer this. Ms. Torres, you asked what the uniform policy is. And I'm just going to say briefly, again, a lot of discussion at the board meeting the other night, and it came down to really letting parents make the decision whether or not they want to put their children in uniforms. So the choice is, if you have, and again, I want to preface it with the context of understanding that people are strapped right now. COVID has taken a toll on everybody. And so we want to respect that parents aren't going out and spending tons of money. Basically, if you choose to put your child in a uniform like you did last year because you have some or you prefer that as a family, you can do that. You don't have to. Students can now wear other clothing. What we're asking, the most important thing is that it's appropriate for school setting. For example, T-shirts that are sexual in nature or have graphics that would be offensive or hurtful to others are not allowed. I hope that clears it up a little bit for you. If you still need more, you can always, Matt, can we just put my number in the chat? People can feel free to call me at the office, and I can explain further. I hope that helped. All right.
There's a question about what is a 24-hour wipe. So a 24-hour wipe is a wipe that leaves a film, an almost invisible film that will not allow the bacteria or germs on that surface for 24 hours. So it continues to kill that bacteria for 24 hours once it's used.
It is citric acid based, so it is food safe.
There's a question about why only unvaccinated students are being screened for COVID and not vaccinated with the new Delta variant.
The transmission among people who are vaccinated is extremely, extremely low. So the Center for Disease Control and DPH has found that screening students who are unvaccinated, adults who are unvaccinated, is where the greatest majority of cases are showing up.
And there's a question about our kids that are playing sports required to get vaccinated. No one is required to get vaccinated at this time. We are strongly encouraging all our students that are 12 and over, including our athletes, to get vaccinated. Close contacts will be quarantining, and it could interrupt the season if they are not vaccinated, or their ability to play in the season, but we are not requiring anybody to get vaccinated at this time, just encouraging.
Jackie, there's another question. It said, referring to the 24-hour wipes, are they food safe or food grade?
Food safe is what they're telling us. It is citric acid.
And then I hope I'm pronouncing it, Ms. Zemgochin. I'm concerned about if a student has to quarantine that they only have access to instructional materials. Instructional material is an instruction and it isn't a lesson. Is there a way for students to have access to a teacher during the school day, especially if this is multiple days? It worries me that after school instruction won't be enough. For the teachers, no. The teachers will be teaching the students in front of them. We are looking into some of our other staff, literacy tutors, et cetera, especially at the elementary grades, possibly helping out students who are struggling. Again, that will be set up through your school with your building principal. And I think I'll leave it at that for now.
Stephanie DeMarco is asking, are teachers, school staff not required to be vaccinated? Just like we're speaking to our students, we are not requiring our teachers or any staff at this point to be vaccinated. We are highly encouraging all of our staff to be vaccinated. We've also provided numerous vaccination clinics in the spring of 2021. Again, we're encouraging our entire staff to be vaccinated.
And again, I want to say, for those who came on late, things are changing, right? I do have a meeting tomorrow. I just sent an email just before I got on the call. There's a 30-minute meeting with the commissioner's office with all superintendents. And so, you know, I want, you know, I love being able to put out a plan and saying, here's the plan, but I can't promise you that changes won't be made. And that's why next week we're going to have another. Next week we'll really kind of just go over any changes that happened or additional questions you may have. So just want to keep putting that out there, that things can change as we move through this.
There's a question about Chromebooks. Our Chromebooks being used in the class, they are not going to be used to the extent last year, but students still will have one-to-one Chromebooks and are not being required or requested to turn them in. They will continue to have them as an educational tool.
That is correct. Staff, at this point, we are not mandating vaccinations for our staff at this point. Working with CVMB, pulmonary department, is fantastic. Is anyone working with child psychology, social workers? So we have partnered with, and Mark, maybe you want to talk about it a little bit, all of our partners that are coming in to help out with that piece this year.
Yeah, we have community partners that are going to be coming in. CMHA is going to be doing support and training for all our staff, pupil services, district-wide actually. Training for our paraeducators and teachers, and to be able to deal and support our children during this transitional period right now. So we've added additional social workers in the district and additional
community health center.
Community health centers, exactly.
Yeah. So we have great resources here in the city, and they are coming to work in our buildings. Groups and individual, and again, something that we offer all families at all times. If your child is in need of counseling, it's simply you can talk to your building principal. Community health center has staff in every one of our buildings, and you can request counseling for your child and for your family actually through Community Health Center right inside our buildings. Backpacks, yes, for this year. And yes, we're asking the students to bring, I believe, and that might change next week. I don't want to say this, but we do want the students to bring their Chromebooks. And again, we had a discussion earlier today. We have to be ready, in my opinion. I always like to think what could possibly happen. So we have to be ready in the event we do have to have another school closure. We have to, right? Because we've seen over the last year and a half, different times when we had to. March 13th, 2019, everything stopped and changed for us. So the students will not be on their Chromebooks all day while they're in the classroom. I don't want you to think that, but we want to make sure that our students stay adept or literate at being able to use that in the event we do have to go into a full school or district closure based on infection rate.
To Mr. Marco, who asked about the current vaccination rate of employees, it's because it's not mandated. I don't have exact numbers because people are not required to report to us. Our estimate right now is over 60% of our employees based on those who have shared that information with us.
And I just got a text from our IT director. He said they should always bring their Chromebooks every day, daily charged and ready to go, because there are a lot of resources on the Chromebooks, right down to textbooks that our students have. So it's become, now that we're one-to-one, and again, we want our kids to be technologically literate, beginning in K and all the way up through. Most of us use computers most of the day, or our phones, or a device. So he said, yes, the Chromebook is a tool, and it's to be with our students every day.
There's a good question from Marie. Are students staying in one classroom again this year, and the teachers are the only ones moving, and can students use their lockers?
Yes, to lockers. And students are able to move again. So, last year we had the idea, and again, mitigation strategies are masking, proper ventilation, socially distanced. I want to see if I can get through all these.
Vaccination.
Well, that's his top one, but the other layered mitigation strategies, cohorting was one of them. And we had kids in cohorts last year and kept them in one room because that was a recommendation from the State Department of Health and the CDC. This year, we want to bring it back to a semi-normal environment for our kids because we recognize they need to be back together. We want it to be as normal a school year as possible. So as far as cohorting goes, the elementary students, they will be going out to recess. They'll be playing with their class. That was the same as last year. But we are allowing them building dependent because of space. And what we don't want to do is put all kids in the cafeteria together at the elementary school. So all elementary admins know they have separate spaces to put kids in, classrooms, etc. But we want them to go to art. We want them to go to music. We want them to go to PE. We want them to do those things. We'll still have exits that are marked for, let's just say, homeroom 1, 2, 3. You go up this exit, just so we have an idea of where these students have traveled throughout the day. But I want to remind you, a close contact is considered anyone who has been, again, outside of the classroom. A close contact is any student or who's come together for a period of longer than 15 minutes over a 24-hour period. So students passing in the hall to go from their homeroom into the gym, they'll be passing by maybe other students, but it's not for 15 minutes and would not be considered a close contact.
There's a couple of questions about hours in the day. We are going back to the regular hours pre-COVID. Those hours are available on the website if you don't remember them. And we are not having Wednesday half days this year. Every Wednesday is not a half day, so we're going back to the normal school hours.
Thanks, Mike. Jeff Prokop, I know you're on here, so you're going to answer this question. Will the new kindergartners have a Chromebook pickup date, or will they receive them at orientation? I'm waiting for his answer. So while we're waiting for that,
And I see a question about transfer students from different towns. Would be able to use that Chromebook? The answer is no. You need to return that Chromebook to the town that you were previously in, and we would provide you with a Chromebook. Because it has to be linked to our network.
Amanda Glowicki, yes, volunteers are being allowed back into the building, but they must be masked and follow all protocols that we have in place. And again, it'll be through, it can't, sadly, we have to make sure people are signing in, that the principals are aware of who is in the building, and that all goes back to the contact tracing piece. Mark, can you talk about Irene Sekatas-Barone? I'm sorry if I'm not saying your name correctly. What happens to an anxious child who simply cannot stay in school? Can you read through that and provide an answer?
What happens to an anxious child who simply cannot stay in school wearing a mask all day and seeing others around the mask? What happens when they have a panic attack so bad that they struggle? Well, there'll be areas of the school for children to be able to stay in school for that day and just be more relaxed and comfortable. So, the short answer is, we're going to look at this on a case-by-case basis. Certainly, there are students who are in certain programs, disabilities. They're in that situation. We work with those students. Again, back to our clinical staff. They work with them to ensure that they have the ability to wear the mask. We provide them additional mask breaks. We go to PPT. We have those discussions. It's a case-by-case basis. So there may be children that will require that. Also, since we're talking about people coming to the building, I do want to mention that PPTs this year, parents will have the choice to have their PPT virtual or in person. If they're coming into the building, of course, they will have to be masked. But the child's case manager or teacher will be reaching out to find out what your preference is. So when we send out invitations and have those conversations for those meetings, we'll know if you want to have it, in person, or if you want to do it remotely as you've done in the past. Okay.
Thank you. And I have an answer for you, Ms. Glowicki. You asked about the kinders and their Chromebooks. And the answer is the plan is to have them at the school for the students' first day of school so we can ensure the Clever, and Clever is the platform they'll be using. The Clever badges will work on each of the computers. That's from Mr. Prokop.
And Ms. Bermudez asked about what masks are recommended for school. The mask should fully cover your nose, mouth, and sit under your chin. Masks with holes and with open ventilation where the respiratory secretions can come out are not used. They are readily available in the surgical style masks, cloth masks, and we have had several community partners donate masks to us that they have made. If you are in need, let us know and we can direct you.
Thanks, Jackie. We have a few that were from YouTube that I'm going to try to answer. Will staff be encouraging our children to get vaccinated while in school? While it's not going to be something that we say every day, we are encouraging all of our families to consider vaccination. This isn't going to be something, no different than political views in school. That's not something we do. And so the answer to that is no. We encourage you as parents to discuss, make a decision that's right for your family. And I'll leave it at that. Should all be tested? Which tests are they using? How is it? They're asking the question about the screens that they're using. They're saying, which tests are you going to be using?
It is a PCR test. It's a swab of the lower end of the nares, of the inside of the nose.
And one of the questions, and Lauren Carter kids, Lauren Carter, how can you ensure that they're actually going to keep distance and mask? It's really no different than last year. I will say our staff was vigilant, our teachers, all of our staff, they recognized the importance of it. And yes, kids are going to be kids, but we had very few instances where students, I mean, we had very few instances where kids didn't comply or wear the mask, including the buses, right? So again, sadly, for some of our youngest learners, this is what they know, right? Kindergarten into first grade. We're all looking forward, all of us are looking forward to the day where we don't have to wear masks and we can move beyond this. So there is someone saying that the family have medical exemptions from the vaccine as family members experience side effects and death from it. I have concerns on sending my daughter on site. Please offer remote. That unfortunately, I'm sorry, that's not within our control to offer remote. Again, things will possibly change in the state over time. And we'll just be, you know, I'll keep you as connected as I am connected as soon as I have the information. Will we have the ability for parent-teacher conferences be through Google Classroom or other platform? It worked out great. And the answer to that is yes. You know, there's some positive things that came out of this pandemic. And I think that was one of them. And Mark, you can talk to the PPTs as well, if parents opt in for that. So yes, your question on that.
Yeah, I mean, that's one of the reasons we're doing the PPTs, giving options, because we found that, you know, we had an increase in parent participation by like 20–25%, and people really want that. So, you know, it gives people an option.
Yeah, and I think, you know, for parents who are working or if they're at home and taking care of things, it's much easier to log on and have a 45-minute meeting without having to, you know, tack on travel time. So if it's convenient for our families, then certainly we'd like to make sure we keep that practice going. It looks like the questions have slowed down. Save your questions again. We'll be back next Wednesday, same time, same place. And remember, this is recorded, so if there's things that you forgot, you can come back and listen to it. And next week will be about any new updates that I have from the state that I'll share with you and any questions that you have.